Hi, my name is Sarah and I'm a nursing student at Glacier Hills. I'm going to present a patient to you right now. Patient is a 77-year-old widowed Caucasian female. Her former occupation was as an art teacher at an elementary and middle school, and she is currently unemployed. Her usual source of medical care is St. Joseph Mercy Hospital. Patient was transferred from St. Joseph Mercy Hospital and was admitted to Glacier Hills Nursing Center on February 15, 2014 for evaluation and rehabilitation of a case of pneumonia. Patient states health was good prior to the pneumonia. At the time of interview, she had been there for approximately 1 month. She expects to be discharged in the next 24 hours. Reason for seeking care. Patient began having difficulty breathing, and upon examination, it was determined that the patient had a severe case of pneumonia over the past month. Patient rates pain as a 2 out of 10. Vital signs were not taken. However, we assume they would be normal due to the fact that she is being discharged shortly. We would expect blood pressure to be 120/80, heart rate in the range of 60 to 100 beats per minute, temperature in the range of 96.9 to 98.3 degrees Fahrenheit if taken orally, and breathing rate to be in the range of 12 to 20 breaths per minute. Past medical history. All immunizations are up to date. No known drug allergies. Past surgical history includes an emergency appendectomy at age 28 and knee replacement at age 70. Patient is on the following medications: 4 milligrams of Lipitor taken orally daily, 500 milligrams of calcium taken orally daily, 200 milligrams of vitamin D taken orally daily, 500 milligrams of Depakote taken orally daily, 100 milligrams of Colace taken orally daily, 10 milligrams of lisinopril taken orally daily, 10 milligrams of Aricept taken orally daily, 650 milligrams of Tylenol taken orally 4 times per day, 60 milligrams of Vista taken orally daily, 25 milligrams of Tropil XL taken orally daily, and 100 milligrams of benzoate taken orally every 4 hours. Functional assessment. Patient denies drug consumption. Patient consumes alcohol occasionally. Patient has normal eating habits. Patient eats 3 meals a day. Patient drinks about 2 glasses of water a day. Patient exercises at home 3 times per week and exercises with a therapist twice a week. Patient's sleep schedule is normal and reports sleeping an average of 9 hours per night. Psychosocial assessment. Patient states future living accommodations are with son in an apartment in Chicago. She states she has a good relationship with her son. Patient denies other outside stressors. Patient identifies herself as a practicing Lutheran. Patient's highest level of education is a master's degree in art. Patterns of healthcare over the lifespan were regular, including routine dentist appointments and doctor checkups. Family history. Patient did not state any history of family disease other than her son having a bipolar disorder. System 1. Review of systems, lung, and thorax. Given patient's diagnosis of pneumonia, it is necessary to assess respiratory functions and capacities. Patient denies shortness of breath. Patient currently has pneumonia. Patient denies history of bronchitis and asthma. No observable cough or sputum production. Patient denies any frequent upper respiratory infections or pain or wheezing. When asked about breast exams, patient admits to not performing them monthly. The significant finding from this review of systems was the patient's pneumonia. Physical exam, respiratory assessment. Upon examination, patient is in no acute distress. AP transverse diameter is normal. There are no signs of thoracic injury or lesions. Chest expansion and rise and fall were symmetrical. Breathing patterns were relaxed with normal rate and depth. Trachea is midline and symmetrical. No noted tactile fremitus. Rib placement is normal with no noted crepitus. Normal lung sounds noted anteriorly and laterally. Wheezing noted posteriorly. Eugophony noted in lower posterior lungs, indicating a consolidation. This is expected as she is recovering from pneumonia. System 2. Review of systems, neurological system. A mental exam and neurological assessment are appropriate to perform due to patient's age. She has no reported numbness tingling, or burning. Patient denies experiencing seizures or loss of consciousness. Patient denies insomnia, concerns about memory or ability to concentrate, or anxiety. Patient has a concern with loss of balance and unsteadiness when walking. This is normal due to patient's age. Patient denies head or neck injuries, taste and smell, or exposure to toxic chemicals. Patient denies symptoms of fainting, dizziness, lightheadedness, light sensitivity, or hearing and vision disturbances. Patient demonstrates slight delayed responses. Upon examination, patient is in no acute distress. Patient is clean in appearance and appears stated age. Physical exam. Neurological assessment. Patient scored 29 out of 30 on the mini-mental exam. Unable to assess gait and Romberg test on patient. Patient exhibits normal upper and lower extremity fine motor function. Patient reports full and symmetrical sensation to light touch and pain in upper and lower extremities. Patient exhibits normal vibratory sensations. Patient responded normally to sternosis, graphaphasia, and proprioception tests. No Babinski or ankylosing noted. Pertinent System 1. Cardiac assessment. A cardiac assessment would be appropriate to perform because patient is taking Lipitor to regulate cholesterol levels. An article from the American Heart Association Journal discusses linkages between prediction of coronary heart disease and risk factors such as total cholesterol, LDL cholesterol, and blood pressure. Given patient's current state, it is important to perform a cardiac assessment to determine if any of these risk factors are present and put her at risk. This way, we are able to take the necessary measures to prevent the risk of coronary heart disease in our patient. Pertinent System 2. Musculoskeletal assessment. A musculoskeletal assessment would be appropriate to perform due to our patient's age. According to a 2013 article from the American Journal of Lifestyle Medicine, age-related declines in muscle strength and power occur at a faster rate than the loss of muscle mass, and this suggests a decrease in muscle quality of older adults. Given patient's current age of 77 years, it is important to perform a musculoskeletal assessment to ensure that she is taking the appropriate precautions to limit muscular degeneration.